Hi, we meet once again to look at another episode of the development of the renal system. This time around, we are looking at clinical consideration and congenital anomalies of the renal system. My name is Dr. Aidoo. I'm with the Department of Anatomy and Cell Biology of the School of Medical Sciences, University of Cape Coast. Thank you for joining me. So we want to look at renal agenesis, which occurs when the ureteric bud fails to develop. And you should remember the ureteric bud by now, that it is an outgrowth of the mesonephric duct. Fails to develop, thereby eliminating the induction of the metanephric vesicles and then nephron formation. You know that the ureteric bud or the metanephric diverticulum that develops from an outgrowth of the mesonephric duct into the metanephric blastema, and that is what will form the ureter pelvis major and minor calyces, and then also have an inductive effect on the metanephric tissue caps that cover those tubules. So if the ureteric bud does not form, then it means that that induction on those tissue caps to form the S-shaped vesicle, which will later on differentiate to form the Bowman's capsule, which will be invested by glomeruli, will not form. So you may have unilateral renal agenesis, that is one side. It's a relatively common and it's more common in males. Therefore, a physician should never assume a patient has two kidneys. It is asymptomatic and compatible with life because the remaining kidney hypertrophies and will take care of the deficiency of the other one's inability to develop. So, as you are aware, this is a possibility. Okay, so you don't assume that any normal person has two kidneys. You should always check. You may also have the bilateral renal agenesis. It's a relatively uncommon one compared to the unilateral one. And this is, it causes oligohydramnios. Remember, we talked about polyhydramnios. And this causes compression of the fetus, resulting in Porter syndrome, which is characterized by deformed limbs, wrinkly skin, and abnormal facial appearance. These infants are usually stillborn or die shortly after birth, so you won't find them walking about. Renal hypoplasia occurs when there is a congenitally small kidney with no pathological evidence of dysplasia. Renal hypoplasia. Hypo means the division or number of cells there are smaller as against hyperplasia. Okay. They also have renal dysplasia. Occurs when there is a disorganization of renal parenchyma with abnormally developed and immature nephrons. So the nephrons are not mature, then obviously they cannot undergo a proper ultrafiltration. Renal ectopia occurs when one or both kidneys fail to ascend and therefore remain in the pelvis or lower lumbar area. In some cases, two pelvic kidneys fuse to form a solid mass, commonly called a pancake kidney. I ask that you look for the meanings of some of these terms in the last video, which contain an assignment listing some of these congenital anomalies. So what may go wrong again? Urachal fistula. So urachal fistula or cyst occurs when a remnant of the allantois persists. It is found along the midline on a path from the umbilicus to the apex of the urinary bladder. So from the umbilicus to the apex of the urinary bladder, you find a large infected urachal cyst there. That's the urachus, that is the urinary bladder. So you expect the allantois to be here. So once it is persisting in the form of a urachal fistula. So this is the cyst showing the a urachal fistula forms a direct connection between the urinary bladder and the outside of the body at the umbilicus, causing urine drainage from the umbilicus. Yes, so you can see drops of urine because it's coming from the bladder. And again, this is also showing a urachal fistula, urine dribbling from urachal fistula. And whenever I teach this topic, I tell an anecdotal story. When I was young in primary school, around class 5 or 6, living in Teshi, a suburb of Accra, there was this madman who was walking about in the area. And at times, we see him urinating from his umbilical area, that is his navel. And we were wondering, but obviously at that age, I didn't know anything about urachus and urachal fistulas. So it is until I um, gain this knowledge, that is when I have a reflection and see that, oh, really? So that was what actually was happening. So indeed, it happens. I wonder if any of you has seen anything like that. If that man was not even mad, I don't think we will see him having that. If he wants to urinate, I'm sure he'll go to a private place. So for all you know, people have this, but then we don't see them in public. Okay, you can also have double ureters. And remember, ureters are formed from the ureteric bud. And once this has bifurcated, it means that it's going to have two ureters. So you have something like that with the bifurcation. You may also have two direct ureters. This is not bifurcating from one stalk, but this is two direct ureteric buds coming from a nephric duct into the metanephric blastema or mesenchyme. So eventually, this is what is going to form two ureters, okay, which will insert into the bladder. So eventually, this is what is going to form. You may also find a normal kidney, yes, which is all that we expect. You cannot have the duplex kidney, so you can see the duplex, it's like a biloop. You have an incomplete duplication, that's the incomplete duplication. You have a blind ureter, one that is ending blindly. Then you have an inverted Y urethral duplication, so it's like a Y and upside down Y. Then you also have a double pelvis bifid or bifid ureter, another bifid ureter, and then a mega ureter. Then ectopic ureteric orifice and post-cover ureter. Thank you very much.